Hey guys, this is Dr. Shumard with Integrative Wellness Center of San Diego. Also the author of How to Reverse Your Diabetes and the Thyroid Epidemic. And today I wanted to do a quick video because we've been getting some pretty amazing comments on some of the videos if you've been following my videos over the last year. And one of those common responses and questions and basically questions around what somebody would like me to talk about is about autoimmune disease. So today we're going to talk about autoimmune disease, and I think it's important to really break it down because many people don't really understand autoimmune disease. They're not really sure the specifics and what it can potentially lead to in regards to your health and overall functionality of your body and potentially other disease processes as well. So when we break down the word autoimmune, what that means is that your own immune system, the system that's supposed to be protecting you from diseases, from environmental factors, toxicities, infection, those sort of things, starts to attack your own body. And that's the auto. So your immune system is attacking your own body, and it's attacking a specific tissue. It could be attacking a specific organ. Essentially, since your immune system is running around your entire body, it can attack anything. It can attack your brain, your skin, your eyes, your heart, your lungs, your kidneys, the muscles, the joints. I mean, literally it can attack anything inside the body. And we want to understand what is really going on. Now, depending on where the specific tissue organ is attacking, there will be a diagnosis. Now, the diagnosis will typically occur from running what is called antibodies. It's a pretty simple blood test where you can get ran at a local lab. LabCorp is who we usually use, and you can run specific testing. So they can run for antibodies in regarding to the liver, or for your thyroid, or for your heart, or for your pancreas, whatever it might be that's being analyzed. And then if the antibodies are elevated, it is telling us it's a positive result for the immune response, meaning the immune system is attacking and destroying that specific tissue. And the byproduct is what are called antibody production. Your immune system does this naturally as a memory cell to remind itself of a specific problem. That's why it's so great, and we get natural immunity for different conditions. Like if you get a specific flu virus, a specific strand of the flu, then you're going to create antibodies to that. So if that virus ever comes back into your body, you're going to have a natural response, and your immune system should handle it pretty efficiently without you experiencing these symptoms or problems. So let's go over some common type of autoimmune diseases that you may or not may be aware of. So this kind of help you out a little bit here. A common one may be lupus. This is very familiar for most people. Lupus. Type 1 diabetes is another common one that people know about. Maybe celiac disease is a common one. Maybe MS. And there's a whole slew of different types of autoimmune diseases. But these are very common ones that people know about. And they're based upon the specific tissue that the person is being attacked. I guess another one we can write in here as well, we talk a lot about in the office, is what's called Hashimoto's. So let's talk about this. Lupus is going to be more of a multiple tissues that it's being attacked in the body. We also see things, I guess one more I can write in here I think is important is fibromyalgia. This is a common one we see as well. It's a common diagnosis that is given when they just don't know, and so they're going to give you a fibromyalgia diagnosis. But lupus is multiple regions. Type 1 is going to attack the pancreas, where the immune system's attacking the pancreas, killing and destroying the pancreas, creating a diabetic situation where the person no longer can produce enough insulin. Very serious. Typically happens to younger individuals, but it can happen to adults as well. Celiac is going to be your specific digestive tract. MS is going to be the nervous system. Hashimoto's is going to be the thyroid. Fibromyalgia is multiple tissues. It can attack the liver, which is called biliary cholangitis. These are types of conditions that are going to affect those specific tissues. Now, what's important is when you understand this, and again, we look at this by looking at antibodies. And antibodies are done through blood tests, right? So we run a blood test, and then we look for the specific antibodies. And are the antibodies high or are they normal? It's really black and white, right? If they're elevated, it tells you you have that problem, you have that condition. There's an issue going on that needs to be addressed. So this is why we want to make sure we analyze the specific antibodies that'll tell us the tissue that's being attacked. Now, by having that information is very important because we have a diagnosis, but now the question should be asked, why? Now, this is very important because in the traditional model, the purpose is, okay, now we have a diagnosis. What are we going to specifically do to treat the diagnosis? And the treatment is usually going to be some sort of pharmaceutical drug. And that may be an immune suppressor. It could be a steroid, which is very commonly given, pain medication, anti-inflammatory medication, whatever it might be, essentially trying to reduce the symptoms of the issue, meaning that we're not trying to figure out what caused the immune system to attack the tissue. We're just going to treat the results of what's going on. So the entire focus, and this is a common thing that I see in the comments that I've seen in the videos I've done, and for individuals that I meet with on a one-on-one basis and a consultation basis, their mindset, because they've been told, is the focus should be on the organ. Well, I often give this analogy, right? If I go up to somebody and I punch them in the face every single day for an entire month, eventually their face is gonna look pretty bad, right? So it'll be broken, there'll be bruising, swelling, maybe bloody eyes, there'll be a lot of cuts, maybe a broken teeth, so maybe some bones that are broken. The person's face is gonna be pretty disrupted. Now, if we only focus on that person's face by, trying to put in maybe some new braces in for their teeth to correct them, some makeup for them, put in some stuff for their eyes to clear them up, does that make sense? Of course it doesn't make any sense, because the problem in this situation, if I'm punching someone in the face, is I'm the issue and something has to happen with me. Well, this is no different than an autoimmune situation. The focus should not be 100% on the tissue that's being attacked, but on the immune system. Because in this specific case, it doesn't really matter which one of these conditions the person's dealing with or whatever else autoimmune condition, the underlying cause is the immune system is sick, it's not functioning properly, it should not be attacking the tissue. What needs to be discovered